Dear friend, we are going to start our today's discussion on the public food procurement system, which is mainly focused on the healthy food procurement system perspective. You know that this policy dialogue is organized by the Eminence, and we're getting technical support from Resolve International, which is a international initiative for talking about the different nutrition and healthy food perspective. Today, so we have several discussants with us. We have Dr. Ikhtiaruddin Khan. He's the head of the Nutrition Health Director for CARE Bangladesh. We have Dr. Mahfuzur Rahman. He's working for health sector for a long time, and he has experience in the non-communicable disease. Recently, he's working with the lead poisoning issues. We have also one advocate from Bangladesh who is working in Bangladesh different nutrition and health issues. Yadia Rahman. Then we have our friend Kingsley Ekunio and Abedimi. They joined with us from Nigeria. Then we have also one of our academic discussant, Dr. Munjur Islam from Mymensingh Agriculture Universities. And Dr. Jaber Mahmood, who is a senior nutritionist in our country, as well as co-chair of the nutrition working group. She will present here as a chair of the discussion. So as we shared with you that public food procurement system in our country, as well as how we can ensure the healthy food procurement system. In this regard, first of all, I like to request Dr. Ikhtiaruddin Mahmood, who has been working in our country for a long time in the health sector. He's leading as a director for health and nutrition in the CARE Bangladesh. I like to hear from Ikhtiaruddin Khan about his perspective and the role of NGOs to ensure the healthy food, public food procurement system. Ikhtiar bhai, can you just start?
No, thank you, Shamim bhai. Thank you very much for inviting me. This is really the great pleasure to be joined here. That the topic basically is very important topic for this time to actually follow. And public food procurement systems, basically food is as a fundamental and essential piece of actually things for life and livelihood. So, but in our country, actually, we can see that our food are not all the cases are safe for us. There are some different actually the steps of food to be actually consumed by the general people. So from the productions to the transportations to the storage and also ultimately the marketing and other pieces. So every stage is actually there are some requirements of safe and protective arrangements. So for the food to be safe. So it can start from the production space. If we are not actually following the safe food policy practices in the production's time, then there is a chance of actually the unsafe food for us. And also there are a number of actually steps. I said that steps for following for food. So the safe food is a concern basically for us because of there are challenges of having the safe food for our population. Especially we are worried about our future generations because there are a number of times we saw that in the markets where from the peoples are actually buying foods, they are not actually getting the safe food from there. Especially if you consider the fruits and other items, they are more actually the risky for us. So I can see that actually there are a lot of spaces to work from the public side. I mean that the government has the regulatory body, and they have actually the safe food policy as well. But the implementations of that policy in all aspects, like the productions to transportations to storage to marketing, it's not equally applied. So there are some, I can see say in Bangladesh, sometimes we can see that there are some periodic follow-up or monitoring happening, but that's not consistent to ensure that food are safe all the times, all the levels and all the cases. So as there are some challenges in every stages of food for safe food, so the government, though government has some rules and regulations, policy procedures, but applications of those are very challenging. So in this context, I can see the non-government organizations who are basically supplementing, complementing to the government's work. They can actually support governments to ensure that the safe food from the productions to the consumers. So NGOs can do some work, like what would be the area where government can step in? What would be the area actually the NGO can mark to the governments? They need to actually give emphasis on these to follow. So these type of things actually the organizations, those who are basically focusing on the nutrition side, so they can actually group together and then take it to the governments for confirming from their end, because all the authority is with the governments. So the NGOs are not holding the authority, but they can support governments. They can actually help government to ensure that policy, to ensure that the implementation of this policy are in place, and where basically the gaps are there, where basically the improvement requirements. So from my experience, I can see there are a lot of areas we can work together with the governments. We can work with the different departments of the governments who are responsible for ensuring the safe food at different stages. So then we can actually support them how they can actually ensure the safe food for our peoples, for our next generations. So procurement is the only is an area where there are some chances of actually the checking, but there are some other places the government need to actually invest their time to actually check that part as well. Like when there are different departments are actually there for ensuring that, like when the productions are going to be happen, so there are some departments need to be actually look at that whether these productions times actually the safe food things are actually considered or not. So I think from my perspective, I can see we need to actually identify some of the areas where we can support governments to ensure that, to emphasize from their end, to ensure the safe food for our country. I think I will stop here now, and then I actually talk more if time permits and later. Thank you.
Yep, thank you, Ikhtar Bhai, for sharing your views, how we can really engage NGOs with the government in this perspective. Now I want to go to Dr. Mahfuzur Rahman, as he's working on the lead poisoning issues. Mahfuz Bhai, what is your experience? Can you share with us, and how academicians and other stakeholders like donors and UN agencies can really help government for ensuring the healthy food procurement?
Nutrition is not a plate of cake for me, because I'm a physician and working with health systems and health. Recently, what I've learned from when I work with the Bangladesh National Nutrition Council, especially for developing the Bangladesh National Nutrition Surveillance, and also working with the paper on COVID, potential projection consequence of nutritional effect during COVID and post-COVID period. When I see that one and working with these two groups, so I learned something that how government can work or non-government can work to make a sustainable nutritional program in Bangladesh. The good thing is nutrition, now earlier we thought that nutrition should belong to the health because it's only health issue. What happens during the participatory workshop, working with the government and other stakeholders, now people understand, the British government and our NGOs understand that nutrition is not a health issue. Nutrition is a multi-sectorial, multi-ministerial, multi-facet issue. So nutrition belongs to the health, nutrition belongs to the nutrition belongs to the agriculture, nutrition belongs to the food ministry, nutrition belongs to the commerce. So it happens that it has many legs that has embedded in all systems in Bangladesh. So that is a good achievement from government, and that is a good achievement from the non-government organization, because that happens by active participation from the non-government and donor agencies. So that nutrition is mainstream. So by doing now, we are focused on healthy food, because the Sustainable Development Goals, one of the indicator and target is non-communicable disease. Another goal is to make the population for no one left behind with hunger, no one left behind from nutritious food. So I think now we have seen that there's active participation of the NGOs, and by endorsing with the government, it is a good achievement for Bangladesh. And if you work together like this way, like participatory approach by government and government, so we can achieve the SDG goal, I hope so, like the NDG. Thank you.
Thank you, Mahfouz bhai. It's a very good point. Now I come to Advocate Yadia Jamal. You have experience to work in the health sector as well as different issues. So can you just tell us that in terms of the public perspective, how much it is important regarding purchasing the healthy food and public food procurement system, and what type of legal issues can be placed in terms of ensuring healthy food procurement?
Thank you. Good afternoon, everyone, for inviting me and giving chance to speak in this important forum. That food and food procurement and safe food procurement. That food procurement, we can gather many food, a lot of food from everywhere, from the country and out of the country. And we can also, but we need to collect safe food safely. And there is so many issues involved with this collecting safe food safely. And at first, I would like to say that although my mother was a very renowned doctor, and my family members now not involved in farming, but I came from that my grandparents, they were the actual farmer. Both of them like farming. And after when my mother became a doctor, and she said her parents that stop farming. They don't like that her thinking, and they was actually involved with farming. And in my childhood, I was at the most of time in the year I was stayed with them in my village. And at that time, I saw that nowadays we are that are NGOs and other organization. We are saying so many talk about nutrition, that safe food procurement, all these things. But at that time, that our village system was that my grandfather. At the time of winter, she was producing vegetable, shorisha, shorisha seed, and at the time of jute, he produced jute. At that time of crop, he produced many type of crop. And that our village was actually that our poor farmers, though they are not enough, that who are working with that rich farmers family, and they also getting safe food. And that was our social economical structure that time in my early teenage. And at that now, after 30 years, the actual situation is actually that's all things is a business oriented factor. Food is now a big business, and for that we have many policies. Recently, actually, after you telling about something, this I actually I learn a lot about that policies, and I find that one of policy I liked, and in that policy that in maybe that is 2012 that part 2 of that the empower of the communities and household to understand the nutritional problems and thereby take appropriate measures to address the problems. I think this one is very important. Nowadays, that the government, now I'm talking as a lawyer, and nowadays we are using that pesticides that is that uncontrolled pesticides that is not safe for safe food. We are using uncontrolled chemical fertilizers that are not safe for safe food. And we must have a good laws to control this situation. And from my childhood experience with that, I want to say that in every day now we have a union, so many unions, and in every union that we need that community will they will observe the how much food, how much vegetable, how much oil they are producing, and how much they will buy other areas. And I think that will that will develop our safe to collect safe food. And what is our topics today's that safe food procurement in this landscape. And I think that's all from me.
Thank you, Yadiapa, for your nice experience sharing with us. Now, can I request Kingsley to share your experience in Nigeria? Kingsley.
Thank you very much. I really want to thank you for this invitation, for allowing us to participate in this very important discussion and workshop. I'm Kingsley Akinroye from Nigerian Heart Foundation, and I also have with me Professor Adebayo Adeyemi and our other members of the team are here. Foundation, we are very interested in this time for us to have this a similar food procurement system and also a policy in this area. And Professor Adebayo Adeyemi is the head of the scientific affairs and is also a nutritionist. You also may have a comment on this. But my question to you, we are interested because of the rising non-communicable disease, and we in Nigeria, and we feel that nutrition is central to the control of this. And we are non-governmental organizations, and we feel that we have been working with government in other areas, and we feel this is the high time for us also to look into this. My question, before my other colleagues can ask, is that during this discussion, you mentioned the working with the National Nutrition Council. I really want to know what were the challenges with working with National Nutrition Council of Bangladesh, and what was their impact in moving this policy forward? Thank you very much.
I have a question to Mr. from Nigeria. That's actually I'm unable to. His name to how
Kingsley.
Tisley. That Mr. Tisley, that you asked that what we are doing about national. What is our national nutrition policies? Actually, as a lawyer, I can say that, but how you people, that your country is facing this problem, that nutrition, that once I visited Senegal in a food program, and I know that that Africa is a very rich country, economically, socially, that are resourceful, that they have many minerals, and but you people are not in that position as like America or Australia or British, but that what is the actual how you are facing this problem?
I'll come to ask Kingsley to give the answer of her point, but before going to your question, can I request Ikhtiar Bhai to give a response of the Kingsley question?
Yeah, no, thank you, Kingsley. Thank you for raising these questions. As you asked that what is actually the role of our Bangladesh National Nutrition Council. Bangladesh National Nutrition Council basically is considered as an apex body to coordinate inter-ministerial work, those who are somehow linked to the nutrition. I mean, those who are directly linked to the nutrition as a nutrition specific work, like the health ministry, and there are some other ministries who are somehow contributing to the nutrition, like the nutrition sensitive. So in total, we identified 22 ministries are actually linked to the nutrition works, like the local government rural ministry. They are basically taking care of the wash part, like the women empowerment, education ministry, agriculture ministry, food ministry. But National Nutrition Council is the apex body to, and is actually the chaired by the Prime Minister. So it's the highly actually the to national level apex things. But their main role is to coordinate between these ministries so that they can actually contribute and take part of that the nutrition works from their respective ministries. So as a part of that Bangladesh National Nutrition Councils, there are different types of actually the committees are set and structured by the government. So there are a number of committees are at the national level, say steering committee, like the coordination committee. Also, there are some committees who are basically playing the role at the district and sub-district levels. So, but these committees are actually have some clear mandate to coordinate between the different departments of the different ministries at the district and sub-district level, and having that committee periodically they need to sit and develop their annual action plan. So, and where the different departments are actually say that what is their plan for this year to support the nutrition, like. So the local government ministry said that we have these activities to support the WASH. So then they will actually take it to the discussions. So this, like this, the agriculture ministry said we are actually produce some the crops for that is very much nutritious for. So they are also, so that discussions is happening at the district and sub-districts level. So on the basis of their plan, they are actually execute that implementation of that plan at the district and sub-district levels. And they are also taking some of the observations from the district and sub-districts level to the national levels to fix it and refer it to the policy level. So these are actually the mechanisms. Currently, Bangladesh National Nutrition Council is basically taking lead of this, and there is the Director General who is basically responsible for coordinate and lead on behalf of the government. But there are some other organizations, like non-government organizations, like academia, like the research service. They are part of that the coordination mechanism at the different levels. But the primary roles basically is taken care by the governments, and there are ministries who are somehow linked to the nutrition are part of that that platform, that council role. So that's in short, basically answer to your questions. Hope it's okay.
Thank you very much, Victor.
Yeah, can I just request Dr. Jeba Mahmood, who is the most senior nutritionist in our country, and she has been involved with the different activities of Bangladesh National Nutrition Council. Jeba, can you just respond regarding the BNNC role as Kingsley asked the question?
Thank you, Dr. Shamim. Actually, Dr. Ikhtiar has actually said all that is to say, and I will only compliment him by saying that we have a national plan of action for nutrition, which is, as he said, the indicators are distributed through 22 ministry, and BNNC is responsible for making sure that this ministries, they conduct the activities and the indicators are fulfilled. So this is the main thing. And added to it, I would just like to say that, it consists of not only nutrition specific, also nutrition sensitive activities, and the BNNC committees are established, not only at the national level, at the very, very sub-national level. For example, our lowest administration is the union, which is sub-district. Just for explanation, I'm saying that. So meetings are held at those levels between the different staff of different ministries. For example, agriculture, health, as he said, women's affairs, etc., education, even the home ministry people, like the police force, everybody, they hold meetings and make sure that all the policies that has been already formulated by the government of Bangladesh, these are followed, and the indicators to improve nutrition nationwide is fulfilled. This is one thing. I won't, that's the ideal picture, of course, it doesn't happen 100%, but, BNNC is there to follow it up every time. And the other thing that I wanted to mention is that, we have the nutrition policy, we have a food and nutrition policy added to this national policy for nutrition. And we are also involved with the SUN, the Scaling Up Nutrition Movement. So you see, we as a Bangladeshi nation, we are under lots of pressure to improve nutrition of the citizens of the country. And we have the operation plan for the National Nutrition Services too, which makes sure that the health side performs best to have a good counseling and advocacy among the pregnant, the infants, and the children, adolescents too. Then we have the safe food policy, which is to make sure that the food that is taken at the table is safe. Food that is sold is safe. I think I would like to end here for this part of my session. And when I give my German speech, I'll talk a little more. Thank you.
Thank you very much.
Thank you. Can I just ask you to respond the Yardia Jaman's question?
With Jebapa, I like to add that public awareness is a very important thing.
Yeah.
that public awareness that actually that in my village I like to work in my village, and every month I go to my village, and one day I have a small shomiti in my village, and one day that from one of mother I am asking that she need a noodles for her child. And for her child, I said, why noodles? Because that is good for health. I said, no, that is bad for health. That public awareness is very important, I think.
Kingsley, can you just respond to Yadia Jaman's question to you, Kingsley?
Thank you. Well, I thank you, Dr. Shabi. May I request, before I add my point, Professor Adeyemi, can you please make a response to that?
And this is being followed up from 2 or 3 perspectives. We have government perspectives trying to create awareness as to quality and good food based on their nutritional values. We also have active participation of non-governmental organizations like NHF and some other professional bodies on the need to consume highly nutritious food. But the question that comes to mind is this: based on the focus of this dialogue, food procurement public policy. What is the food procurement policy that exists? I would say that as far as Nigeria is concerned, the emphasis for now is more or less in the school feeding program for primary and secondary schools, okay? Laying emphasis in terms of public food procurement. But at the same time, some other agencies, like maybe the prisons, the police, and what have you, where the hospitals, where there's direct public procurement policy. Although attempts are being made in terms of the quality, but this has not been properly documented, okay? But having said that, the areas that government at times does make procurement is in terms of the strategic grain reserves, the storage. In that case, they make bulk purchase and store. But in terms of the generality, only the awareness is created. Not that government is directly involved in procurement to either market or to processors. That's where the gap is. But no doubt about it, there's an awareness on the need for healthy foods, especially with respect to the present COVID-19 and its SDG goals. So that would be my comment for now.
Thank you. Dr. Shami, I believe is covered. Yeah. Dr. Shami, I believe is covered.
Yeah. Before I go to our chair, I like to request Dr. Mahfouz, after the discussion and hearing about the Nigerian experience, we want to hear your last voice, how we can move forward to ensure the healthy food procurement within the public system in our country. Dr. Mahfouz.
Yeah, thank you. I think we cannot adopt the Kingsley adaptation policy, but Bangladesh has made much progress in nutrition, and Dr. Jeba and the care health act.
Yeah.
So I think we have made good progress. We were in line, and Bangladesh government has a very good plan and how to, especially what you have seen during the COVID, they have made a targeted population. We need to target the population, those are vulnerable, the hard to reach, and target the population, ensure the nutritious food, especially the balanced food, because now we are discussing about the imbalanced food, nutrition, and non-communicable disease. and which is making out of expenditures, out of pocket costs. So government has a good plan, and BNC is the apex body, that's true. And also government has a nutrition entity in busy health. So all together, government, especially the Prime Minister office, they have a very good plan to adopt what they're planning for, to targeting the low income group and also the ultra poor, to make them available to access the nutritious food. And I hope if you go in this way, as your target is the 5th-year plan and also the SDGs. So I hope in 2030, we'll see no hunger, we'll see no deaths due to malnutrition, and we'll see a healthy and nutritious population in Bangladesh.
Thank you, Mahfouz bhai, for your nice recommendation. Though we have a little bit more time, but I'm going to request our chair today, Dr. Jeba Mahmood, to give her, discussion point and guide us how we can move forward to ensure the healthy public food procurement system, and engaging different NGOs, UN system, as well as others. Dr. Jeba Mahmood.
Thank you, Dr. Shamim, and thank you, other participants of this very important, I would say, a very important thematic session. As we all know that the public system procurement, if we only talk of the public system procurement, it not only affects the, as we say, the government offices, the jails, the schools. In addition, we also have a safety net program where the ultra poor are provided with balanced diet, as we say. And this brings me back to the old Bangla adage is that, do we live to eat or do we eat to live? So, it means that actually, it means both sides of malnutrition that we talk about, because if we don't have enough food to eat, then we suffer from undernutrition. Then on the other hand, if we eat only to live, we suffer from the other end of malnutrition. And taking Bangladesh as an example is that actually we are standing on the brink of both sides. We do have undernutrition still in the country, and especially among the vulnerable groups. But the same vulnerable group and others are also showing the other side of malnutrition, that we are becoming overweight and tending to go to obesity. And this is due to intake, as we say, junk food, which contains too much trans fat, which contains sugar, and which contains too much salt. And it was very interesting when Iadi Jaman, she said that somebody asked her whether I should take noodles. I had this same conversation at one of the government hospitals, where this woman, thinking that, oh my God, this is a doctor from Dhaka. So she asked me that, can I eat Horlicks? I said, why do you want to take Horlicks? And she said, well, they give me 2 eggs. I can sell 1 egg off and take Horlicks. I said, excuse me, please do take 2 eggs. Forget about the Horlicks. So this is a natural state of our country. It's a style. It's a established fact that if I can go around telling that, oh, I took a beef burger or a chicken burger, instead of saying I took what is staple for our country, bhat and dal, that is, rice and lentil, we try to avoid it. So, as I already mentioned, that we have lots of policies in the country, but this healthy public food policy is very much required. It is not only for the country, I would say worldwide. I really don't have the data on how many countries has this, but this became much more prominent, I would say, during our pandemic situation, when there was a let's not say shortage of food, but there was a want of food because people were out of livelihood, people didn't have work, Then there were some markets also which went out of business because there was transport. Fish couldn't come from our coastal region. Chicken couldn't come. Whatever vegetables couldn't come from the outskirts of the. So there was a shortage in the markets too. And what we were started providing sometimes not only through our public facilities, even personally, or the NGOs were working, they were not giving healthy food. And in addition, what we have right now is a disaster public food policy, that healthy food policy. So there's a guideline in Bangladesh, what are the healthy foods that should be provided during disasters. And this actually brings me back to a very old story which happened during our cyclone. We are a very cyclone country, and we had Ayla, which was a very devastating cyclone. And I remember Dr. Shamim coming and telling me, Apa, they're providing snack foods for children, shingara, instead of rice. And like, I was shocked as he was, like we had been working in public health. And even today, 4 years back, we still provide food which is full of trans fat, which should not be actually eaten by anybody, not and especially the children. So this healthy, as I come back to it, this healthy public food policy is a much more need. And before that, Mim is saying that we need to work together. We need to convince the government and the NGOs, the developing partners, that this healthy policy, public food policy, is a must. First is the advocacy for that, and next will come, what do we put into this public food policy? Very recently, we have been doing a costing of healthy food in the country, and we did it district-wise, looking at the culture and the taboos, and that is, even though we are a small country, our different regions have different cultures of taking food. And this food habits is something very difficult to break, but is a need. And I say again that this healthy food is a must. Even what we grow is also very essential that we look into it. Then comes the storage, the subsidy, and the food preparation, and what comes to our table and what we eat. So I would like to end here by saying that let's all work together to formulate a healthy public food policy. Thank you.
Thank you, Appa, for giving your space as a chair, as well as an expert in the nutrition and long experience in the nutrition field in Bangladesh. As well as you are a co-chair of Nutrition Working Group, we really consider your speech as a milestone for us. In this perspective, Abeda and Kingsley, lots of questions. So we'll have 2 more policy diet next 2 weeks. 2 months, so we'll come back with the response of Kingsley and Abeda's question. So thank you all for joining with us today, and thanks from Eminence and Resolve for taking forward this. This is a very preliminary discussion, and we want to really take forward of these issues in our government and make a good policy in our country for a public food procurement system. Thank you all. Thank you so much.
Thank you, Shamin.